Today's video focuses on what an IMG has to know to match successfully. These charting outcomes from 2020 are meant to give you a more accurate depiction of the reality. We can start with the most accessible residency, that is internal medicine. In the case of internal medicine, as we can see, the mean step 1 score is 237 and step 2 score 243. The research experiences are around 2, with 5 abstracts, presentation and publications, and 6 work experience for. What is more, the mean number of volunteer experiences is around 4. Thus, we can observe that the match rate is around 60%, which, although it seems low, it is one of the highest for medical specialties. Internal medicine is the most applied specialty. It gives the opportunity to pursue medical fellowships such as gastrointestinal fellowship, cardiology fellowship, other fellowships such as endocrinology, rheumatology or infectious disease. Now, let's talk about the specialties that require a transitional year. The specialties that require a transitional year or a preliminary year are anesthesiology, dermatology, diagnostic radiology, physical medicine and rehabilitation, neurology, and finally ophthalmology. The hardest specialty with a transitional year to match in is dermatology. Why is it hard? Well, dermatology has a great lifestyle, with attendings working between 45 and 50 hours and an extremely high revenue per amount of hours worked. As you can see, the mean step 1 score is 241, while the mean step 2 score is 247. However, as you can see, the applicants have a leg up. They have 35 abstracts, presentations or publications. They have 4 volunteer experiences and at least 6 work experiences. The match rate for dermatology is 44%. Another specialty that requires a transitional year is neurology. Neurology has a special lifestyle, meaning a normal one from 9 to 5. However, there might be some night shifts. The outcome of the patients is usually not ideal, and this makes neurology a little bit tougher. For the stats, as you can see, it's an accessible specialty with a step 1 score of 233 and a step 2 score of 239. It is more research heavy with 11 abstracts, presentation and publications, with 6 work experience, from which probably 3 of them are research. The match rate is even higher than in the case of internal medicine, around 68.55%. The last one that we will discuss with a transitional year is diagnostic radiology. Diagnostic radiology has a great lifestyle. It has the possibility to work from home or remotely, and it lasts around 5 years. As you can see, the mean step 1 score is around 239, whereas the mean step 2 score is around 242, with an emphasis on abstracts, presentation and publications around 16. The number of work experiences are around 5 and only 3 volunteer experiences. For the research experiences, they are around 3. The match rate is a good one with a 64.38%. Now, if you want a weekly summary of USMLE related content, send an email to medicalperspectiveblog@gmail.com. When talking about the hardest to match as an IMG, the specialties that come to mind are neurological surgery and interventional radiology. Firstly, neurosurgery does not have a great lifestyle. Sometimes you will stay in the hospital even more than 80 hours. However, there are a lot of brainy people, smart and accomplished. As it is a surgical specialty, you will hit a lot of egos, but due to the frequent outcomes, the surgeons in neurosurgery field are more modest. From a stats perspective, as you can see, the step 1 and step 2 C score on the mean are higher, 243 and 245. When talking about abstracts, presentation and publications, they are an outlier. Neurosurgical residents have on mean 61 abstracts, presentation, and publications. They have around 5 work experience and 2 volunteer experience. And as you can see, 50% of them have another graduate degree. The match rate is far from ideal, with a 25% chance of matching. Another specialty difficult to match in is interventional radiology. This is the short track, meaning that instead of diagnostic radiology of 5 years plus 2 years of ER, you are doing 5 years with interventional radiology. As you can see, the step 1 score on the mean is 232 with a mean step 2 score of 241. However, the number of abstracts, presentation, and publications is again high, around 19, with 8 volunteer experiences at least, and some around 3 research experiences. The match rate is even lower than neurosurgery, with 18% chance of matching. Now that you have a better perspective, it is high time you find a spot for research. Check out this video.